mynews.studio.
86 million girls. One vaccine. In some countries, cervical cancer has almost disappeared. What does all this mean for everyone else?
Today is November 22nd, 2025. Let's start with that first number. Over 86 million girls in high-risk areas have received the HPV vaccine since last year. That's according to the newest World Health Organization data.
What's really striking is the speed. These programs have scaled up fast. We're seeing vaccination, screening, treatment, even in regions that not long ago had almost no infrastructure. Why now?
A lot of it comes down to international support and some new strategies. School-based vaccination programs have been crucial. For example, in the UK and Australia, vaccines are linked to school entry requirements. That's driven a huge drop in cervical cancer rates.
And there's the shift to a single-dose vaccine schedule, which the WHO approved in 2022. How does that change things for countries with fewer resources?
It's really significant. Instead of needing 2 or 3 doses, now just 1 is enough. That means twice as many girls can be vaccinated with the same supply. Also, fewer clinic visits.
So less chance people drop out halfway through.
Exactly. It cuts down on missed appointments and all the logistical headaches.
But myths and concerns have slowed some programs. What are countries doing to close those gaps?
Targeted community outreach has made a difference. Local networks are educating families, pushing back against rumors, and addressing cultural concerns. They're also using reminders, checking clinic records to follow up with anyone who missed a dose. That's helped, especially where healthcare access is uneven.
Let's talk about the funding. Gavi, the Vaccine Alliance, and the WHO have both stepped up. How are they handling costs and logistics, especially in the countries with the highest burden?
Gavi relaunched its program in 2023 with ambitious targets. They're providing funding and technical help, helping countries negotiate vaccine prices, improve cold chain systems, and run national campaigns. Altogether, these efforts have brought the vaccine to countries responsible for nearly 90% of cervical cancer cases worldwide.
And it's not just about health outcomes. Gavi reports that in 43 of these countries, the economic benefit has topped $2.3 billion since 2014. That's not just lives saved, but resources and productivity gained.
The WHO's single-dose recommendation helped too, lowering costs, simplifying logistics. But even with all this momentum, there are still risks. What are the main ones?
There are several. Weak healthcare systems in some low- and middle-income countries still limit both vaccine delivery and follow-up screening. And vaccine hesitancy, driven by myths or misinformation, remains a barrier in certain communities.
Supply chain problems, funding gaps, or new health emergencies can slow things down or even reverse progress. Some groups, especially in rural or marginalized areas, are still missing out. Are enough resources being directed to reach them?
That's really the big question. Without ongoing investment and strong political will, those gaps could widen, and public trust is fragile. A single setback could have ripple effects.
Why does all this matter for the world? Cervical cancer hits women in low and middle-income countries hardest. Near elimination would be a major step for global health equity.
It's not just a story about science. It's public health and international cooperation working together. Maybe even a blueprint for tackling other preventable diseases. So, what lessons can future health campaigns take from this?
Scale matters, partnerships matter, and adapting to local contexts, using schools, community outreach, turns science into real results.
In the end, we're seeing what's possible when resources, political will, and community trust come together. But this isn't the end of the story.
It's a milestone, not a finish line. Thanks for joining us as we unpacked the facts and future of global cervical cancer prevention.
We began with a question. What if cervical cancer became a thing of the past? The answer, hope, and maybe a roadmap for what's next. Thank you for listening. This episode was powered by mynews.studio. Try it now for free.